No bend your nose backward. Don't. I repeat, do not bend your nose backward. Why? But today I wan do this video because of one of my patients. The patient, he come dey bleed for nose. Now I say I need to teach you make you understand. So this thing mean say when person dey bleed from the nose bleeding. Now if you look very well, hey, make I draw am well, if you look very well, you go see say some people don get bleeding from their nose and they no know wetin to do. This guy get biabia, he get biabia like this. When you look very well now, epistaxis na bleeding from where? From the nose. And we get two types of bleeding from the nose. We get wetin we dey call anterior, anterior I go tell you, and wetin, and posterior, posterior. So anterior mean say e dey come from the front part of your nose, the front part. Posterior mean say the bleeding dey come from inside. Ma change the color so that make you see am well. Posterior mean say the person dey bleed from inside. Anterior na front. But remember, make you open your ear. A lot of arteries, or wetin we dey call blood vessels, a lot of them, small ones, dem plenty inside your nose area. Dem dey around inside like this. Dem plenty inside. So if something do you, these blood vessels wey dey your nose area, e fit just cut small, and when e cut, you fit see blood come out. If e just come out for your nose, just come out. And guess what? Na this anterior na im dey common pass. This posterior, e no too dey common, but if e happen, e can wetin? E can tie wrapper. E can serious well. So a lot of people, most times, na this one they get and they go dey panic, dey fear. And most times, we no dey too do anything for the person. Go tell you say calm down. But wetin fit cause am make person dey bleed from the nose? Number one, maybe we dey call am local. Maybe you use your hand, your own hand. You dey put hand inside your nose by yourself. Dey put hand. One way, your hand fit just enter inside. You go cut. As you cut am like this, you go see blood. Your hand, local. Now another one again, na trauma. Maybe you go block Anthony Joshua. You can't light you, better one for nose. As it lights you, your nose swell up, it dey come out. So trauma. Or you hit your nose from somewhere, or you fall down. Trauma, you fit get bleeding from the nose. Another one again, now wetin we dey call systemic. I wan just tell you small, sharply. Systemic. Some people get high blood pressure. And when that high blood pressure do them, high BP, make I explain am complete. When e do them, e fit affect some of them, or some, not everybody. For here, because of the pressure, e fit just cut small, boom, blood fit come out. Some other people again, na the weather fit dey very dry. And when the weather dey dry, inside your nose go be like say e dey pepper you inside. If you just cut small, boom, as e cut, blood go come out. You come be like, hey, wetin dey do me? Wetin dey do me? Calm down. No panic. Another thing again, e get some people, dem get some kind blood issue. We dey call the issue, we dey call am like coagulopathy. Abeg, leave this big grammar. Leave am. They fit get some kind blood issue. E fit make them bleed from nose. Some other people, some kind medicine dey. We dey call these medicines, we dey call them anticoagulants. Some people dey on some kind medicine. This medicine fit make them wetin? Bleed from the nose. Now, if you dey see me for the first time, my name na Dr. Fredostar. I be licensed medical doctor, and I dey make health videos in pidgin English as simple as ABC for you. Abeg, I no dey treat anybody, I no dey private chat, I no dey give my number make anybody call me because I dey very busy. Abeg, if you get any problem, go follow your doctor talk, make dem treat you. Here na teach I dey teach. Abeg, thank you. Now, if somebody don get bleeding from the nose, wetin make e do? Number one, where I go put am? Number one, remain calm. Abeg, see am, oh baby, remain calm. No this, hey, no, calm down. Number two, I remember I tell you say most of them na anterior from this first part of the nose. So wetin make you do? No bend your nose backward. Don't. I repeat, do not bend your nose backward. Why? Because if you bend your nose backward, see this blood, you fit carry am enter. And remember wetin dey inside here, things like your brain inside. Do not carry your nose backward because you fit go push blood go into your brain. We don't advise it. So if you see say person dey bleed from the nose, calm down, bend forward, the blood go come forward. The next thing wey you go do, pressure. Pressure. Use your hand, hold am on top this place. No be the bone o, this one. For how long? For like 10 minutes. Put pressure there. Dey breathe with your mouth. Put pressure, because we don tell you before, when you put pressure there, this bleeding fit stop on your own. You dey follow me? So this is what you can do at home to help you. No bend. Now if you notice say you can't do pressure for like 10 minutes, you do am. After you comot your hand, you do am again, e con continue, then enter hospital. Because when you enter hospital, e get some medicines, they go put am inside cotton wool, they go put am inside the person nose, they go put am inside. Those medicines, e go make all this blood vessel, e go make them come dey close by themselves, make them no bleed again. So they go put am, but you can't do that at home. You dey hear me so? So you go hospital, they go put am for your nose. Sometimes when you come enter hospital, they will come look and say, this one serious, so your own no be anterior, your own na posterior. Sometimes they fit come put some things inside the nose, come take block am, take hold am, make e stop. If you know say you no dey follow me, click on the follow button, make you no miss out. Now I just say make I do this video because of my patient wey go dey bleed for nose, e come dey bend the head backward. So abeg remain calm. Number 2, just hold your hand like this. Dey breathe with your mouth. Not do like this. So if you do like this, you can give yourself another problem. If you even enter your lungs, if you come dey cough, come get another problem. You hear me? So then when you enter hospital, they will give you some things. The name wey we dey call them, some of these medicines, we call them vasoconstrictors. Because some people come wetin? Constrictors. May I spell am well, abeg. You see am? Yes. They go help you close and make you no bleed. Some people fit get bleeding from the nose, and if it be from malignancy. Malignancy. That is why if you notice say every time blood dey comot from your nose, every time, then see your doctor. Make your doctor check you and find out wetin dey go on. No go sit down for house when the matter come tie wrapper. After you come dey come hospital, you come dey blame village people. Abeg, share this video, make more people come learn. I always tell you, good life na wetin? Good life na sense o.